thank Dr. Cameron Wilkinson for being the acting Chief Medical Officer in her absence. I first would like to invite to the podium Superintendent Cromwell Henry to bring us his updates with respect to the regulations for the COVID-19.
Thank you very much, Mr. Williams, and a pleasant good afternoon to all listening to this broadcast via whatever means. The current iteration of the Emergency Powers COVID-19 regulations runs from October 21st until November 4th. No new provisions have been included in these regulations. Therefore, we expect continued adherence to the COVID-19 prevention protocols, which you are by now well aware of. We continue to see new COVID-19 infections trending downwards, which is an indication that you are doing something right. The police and the compliance team continue to work together to ensure that event organizers and bar operators operate according to the terms and conditions of their permissions. Please note that the conditions stipulated are in accordance with the regulations and are intended to keep your staff and patrons safe. To standardize our operations across the Federation, 10 compliance officers underwent a 2-week training course in Nevis and have now graduated and will be deployed shortly in the field. These officers are empowered by the COVID-19 Prevention and Control Act, where at Section 4.5 it states, a compliance team may visit or inspect any business, enterprise, or office, monitor any social event, and issue fixed penalty notices to ensure compliance with the provisions of the Act. A person who obstructs any member of the National COVID Task Force or a member of a compliance team commits an offense and is liable on summary conviction to a fine not exceeding $5,000. We therefore ask that you give these compliance officers your fullest cooperation whenever they enter your business, establishment, or event in the execution of their duties. I will close with my usual admonishment and ask you to remember to always to wear face masks when you are in public, maintain a physical distance of 6 feet from others, practice good hand hygiene and other sanitization behavior, and avoid crowds and crowded places, and if possible, get vaccinated. Thank you.
Thank you, Superintendent Henry. I now invite Dr. Hazel Laws, our Chief Medical Officer, to bring us the Health Emergency Operations Center situation report for today.
Thank you, Mr. Williams, and a warm good afternoon to everyone. This is my first press briefing since I'm back, and I must say I'm happy to be back this afternoon. I want to use this forum to officially express thank you to Dr. Cameron Wilkinson, our Medical Chief of Staff, for covering my desk during the period when I was overseas. I'm extremely grateful for the opportunity of spending quality time with my daughter and, of course, for the well-needed break. This was my first real break in 21 months, or almost 2 years, and I appreciated the time off immensely. Okay, so as per usual, I will share with you the Health Emergency Operating Committee's situation report for this afternoon, or for today, Wednesday, October the 27th. Now, ladies and gentlemen, we have been responding to the COVID-19 pandemic for almost 21 months. We've experienced 3 COVID-19 waves of infection. We've done well in terms of containment. We've contained the first and second wave, and the third wave is under control. Now, this third wave started approximately around about August 10th to 15th, and we are still counting cases. Now, this slide shows the 7-day incidence, meaning the newly reported cases within the last 7 days. This is over the last 3-week period. So newly diagnosed cases per 100,000 population. And so you can see a drastic decrease in the 7-day incidence over this last 3-week period. This shows, this is a picture of the wave which started the 10th of August until present, and we are on the other side of the curve. This also shows the actual number, the daily counts over this past week between August 20 to 26, and the numbers are going in the right direction, approaching single digits, and we want to keep it like this. Okay, so between last Wednesday, the 20th of October, to yesterday, Tuesday, October 26th, we've added 57 cases, which is 66 cases less than the previous week, October 13 to 19. During this past week, we've only had 2 hospital admissions, and that's at the JNF General Hospital COVID ward, and 4 patients have been discharged from the COVID ward during this period. We continue to have a number of recoveries. Up to this afternoon, 180 patients recovered over this past week. No deaths. We've not had any additional COVID-19 deaths. Now, in terms of the status, the COVID-19 situation on the ground, we have now a total of 2,646 confirmed cases of COVID-19, with 421 cases reported for Nevis and 2,225 cases reported SIN kits. In terms of the active cases, 294 active cases being monitored as we speak, 53 on Nevis, 241 on SIN kits. Now, as I said before, the recoveries continue. Patients diagnosed with COVID continue to recover quite nicely, bringing our total to 2,331, with 365 recoveries on Nevis and 1,966 recoveries on SIN kits. As we speak, there are only 7 persons admitted on the COVID ward at the JNF General Hospital with the diagnosis of COVID-19. There aren't any admissions at the Alexandra Hospital as we speak. And the COVID-19 related deaths, the count remains at 21. Now, in terms of the COVID-19 related deaths, we've had 21, 3 reported on Nevis, 18 on SIN kits, and majority were unvaccinated. Now, in other words, if you look at this slide, you realize that if you are over 60, if you are unvaccinated, and based on the data we have, if you have comorbidities, your risk of death from COVID is increased. Now, in terms of the COVID-19 cases, based on our analysis, majority of the cases are unvaccinated. 68.4% of the COVID cases unvaccinated, 8.3% partially vaccinated, and about quarter, 23, almost quarter, 23.4% fully vaccinated. So again, if you are unvaccinated, your risk of picking up COVID-19 is increased. Now, in terms of our vaccination status, we continue with our COVID-19 vaccination program, which started on the 22nd of February of this year. So to date, 24,227 persons are fully vaccinated, having received 2 doses. And so in terms of coverage rate, that makes the coverage rate 72.1% of the adults in our population receiving 2 doses are fully vaccinated, and 76.6% of the adults have received a first dose. Now, as you are aware, we received a kind donation of Pfizer vaccines from the United States government, and we are offering this vaccine to adults and children 12 to 17 years. And to date, 11.7% of our children within that age range, 12 to 17, they have come forward, they have received the first dose, and 8.2% of the children within this age range are fully vaccinated. They have received 2 doses of the Pfizer-BioNTech vaccine. And so our vaccination program continues. So to date, this just summarizes the vaccination coverage rates. Total adults in the population fully vaccinated, 72%. Total children, 12 to 17 years in our population that are fully vaccinated equals 8.2%. Now, when you look at the total number of adults fully vaccinated, total number of children fully vaccinated, and you put that over our total population, that gives us the percentage of the total population fully vaccinated. That equals 51.3%. Now, ladies and gentlemen, this is a success. The percentage of the total population in our federation fully vaccinated, 51.3%. Now, when you look at the latest information coming out of the World Health Organization, all territories around the world are asked to achieve the WHO call to action to have at least 40% of its population vaccinated by December 2021. And it's with good news we share with you that the Federation has surpassed this target, this cut point, this benchmark. And I dare say we surpassed this benchmark round about the end of August, early September of this year. The Pan American Health Organization will be acknowledging the Federation's achievement by publishing an article on the Federation's strong leadership in the vaccine rollout. So actually, this is a success story. St. Kitts and Nevis is the first independent territory in the Caribbean sub-region to cross this benchmark. And this article will have a global reach. Now, in terms of the vaccination program in schools, the Ministry of Health is collaborating with the Ministry of Education in educating our parents and our students about the COVID-19 vaccines. And so we are targeting the PTA meetings, and we've done so over the past 2 weeks. Now, schools are given specific dates when the children can come into the nearest health center to receive the vaccine. However, we want to recommend that parents and guardians, please feel free to bring your child in on any clinic day without an appointment. So you can come into any health center Monday to Friday, and even Saturday and Sunday with your child to receive the vaccine. So you do not have to wait on an appointed date or time when the school has an appointment to come into the health center. Now, this news came out yesterday. The FDA advisory panel okays Pfizer's vaccine for children aged 5 to 11. So a smaller dose of the Pfizer-BioNTech COVID-19 vaccine cleared its first regulatory hurdle yesterday, October the 26th, for use in children as young as 5 to 11 years. The Food and Drug Administration Advisory Committee voted to recommend it for emergency use authorization for children within this age band. The FDA is expected to make a final ruling in the coming days. So, what is a COVID-19 vaccine booster? Now, a COVID-19 booster shot is really an additional dose of the COVID-19 vaccine given after the protection provided by the original shots has decreased. So the booster is designed to help persons maintain an adequate level of immunity for a longer period of time. So the booster shot is really meant to provide that additional coverage in terms of immunity to protect you against the virus, the SARS-CoV-2 virus that is undergoing innumerable mutations. What is a third dose of the coronavirus vaccine? So a third dose is, as it says, most of the vaccines to date have 2-dose regimens, so the AstraZeneca, the Pfizer-BioNTech, and the Moderna. So in terms of the mRNA COVID-19 vaccines, if you would have received the previous 2 doses, you can get a third dose, which is identical. The same amount of the vaccine will be administered. So the third dose is identical to the previous 2 doses. It can help protect persons with weakened immune systems who did not have a strong enough response after the first 2 doses. Persons can get a third dose as soon as 28 days after a second dose. So within, let me just add, who gets this third dose? So the COVID-19 vaccine booster shots or third doses are available, will be available for persons who would have completed the initial series and 6 months would have elapsed between the second dose and present. And so persons who are elderly, persons who are 65 years and older, persons who are vulnerable. So persons, adults who live in long-term care facilities like nursing homes and prisons, adults who have underlying medical conditions like cancer, autoimmune disease, and persons who are maybe taking steroids for other medical conditions. Adults who work in high-risk settings, so like persons like healthcare workers who work on COVID wards, etc., or frontline workers in high-risk settings. These are the individuals who are targeted initially to receive booster shots or third doses. Now, what is long COVID? So, ladies and gentlemen, we have a number of persons who would have been diagnosed with COVID-19 and they would have recovered. But more and more of these individuals are voicing complaints in terms of symptoms. Even though they've recovered, they are still experiencing some lingering symptoms. And so the Lancet, a renowned medical journal, just published an article referring to a new study on this topic, long COVID. And they found that about half of the individuals or COVID-19 patients who were hospitalized had lingering symptoms for as long as 1 year. So please note, however, most COVID-19 survivors have good physical and functional recovery right after, right? So what they found is that during the 1 year follow-up, most of the survivors, they recovered, no problems. However, some of the survivors continue to experience long-term health consequences of COVID-19. Please note that the most commonly reported symptom in terms of long COVID is fatigue and muscle weakness. So in other words, persons who would have recovered from COVID, it won't be unusual for them to complain of lingering fatigue, malaise, muscle weakness. Some complain of shortness of breath, sleep difficulties, palpitations, racing of the heart, hair loss, pains, general aches and pains, joint pains, some discomfort in the joints and muscles,